Okay. I'll just ask everyone to check your phones and computers and make sure that you're muted. You should be able to see my PowerPoint, and I'll go ahead and get started. So as usual, if you're not with the schools or the health department, we'll ask you to jump off the call and just check our website for this PowerPoint and presentation later. Pass along any information to anyone else who might need it. I just wanted to give some updates other than COVID for a change. Just an influenza update. As of the end of October, about 1 in 5 people in Michigan had received their flu shot. So we still have quite a ways to go. So encourage everyone to get their flu shot. We have already had some flu activity. It's still very minimal. All the typing that's been done so far has found that it's the H3N2 strain, so influenza A, H3N2, which is typical for this time of the year. There has already been one flu outbreak reported in a long-term care facility in Southwest Michigan, and typically our flu activity does start in the southern part of the state and work its way up. So just an update there. This is another interesting thing that was provided in the most recent weekly flu update. I did provide the map when they're talking about different labs, southeast, southwest, central and northern. There's all these different ways they break up the state of Michigan. So I just want you to notice that there's only one northern lab and 4 central labs contributing to this, so not a ton. But just to notice, in terms of other viral respiratory illnesses, in the central region of the state, there's been moderate RSV activity, low to moderate parainfluenza activity, which is just another respiratory illness, and just slightly elevated adenovirus activity. And then in the northern region, again, there's only one lab that's been reporting any data on this, so hard to really know how reliable it is, but low activity on pretty much everything. In this vein, because we've been seeing, and I know some of you have been experiencing illness that's not COVID, so it's the point where some have had to actually take some breaks from education from non-COVID illness. So I just want to remind you that the Managing Communicable Diseases in Schools resource is extremely useful for any communicable disease in schools, and it does have in their updated version COVID information as well. But just a reminder that part of the Public Health Code does require reporting of aggregate counts of flu-like illness, but also immediate reporting, not just in your weekly report, but immediate reporting to us of any outbreaks or suspected or confirmed communicable diseases that are going on in the schools, anytime you need to close due to illness, and then any suspected or confirmed cases of vaccine preventable diseases, meningitis, hepatitis, tuberculosis, or anything that seems serious or unusual. So just a reminder there on those things. One thing that's recommended, I know a lot of you have like an absence phone line. You can put some verbiage in the message saying, that the law requires that you have to report certain things to the health department. And so to help with that, please include your child's illness, who diagnosed it, or detailed description of what symptoms they have, something like that, so that it makes your life a little bit easier in terms of reporting these things. This also helps you because then you know what might be going around in your school, so you can hopefully keep everybody as healthy as possible and keep things going. So just a little advice about considerations for closing. So this is not a make or break situation. This is not meant to be definitive, just to give you some ideas. You don't necessarily have to close just because you have an outbreak, and I'll go through the definition of an outbreak here in a minute. But it has more to do with what's going on overall. So do you have uncontrolled spread going on in the school despite your best efforts? Is it safer, is it better for them to be home than in school, basically, knowing that there's large benefits for them to be in school? So have you been doing all the contact tracing, quarantine, anything you can do, yet you continue to have more and more cases in the school that you can't seem to control any other way than just breaking the cycle and having everyone home for a while? And is education better off by taking a break? Do you have enough kids at home that it's just difficult, or you're going to have to just repeat everything because you're trying to do two different curriculums, both virtual and at home, because so many kids are at home? Or it's so difficult to do it that way, you're just going to have to repeat everything once they come back. Are you missing too many staff members or teachers to where you can't safely or adequately run your building? So those are just things to consider when you're trying to decide whether or not you need to close. And again, we're always happy to talk with you to help work through these decisions. And then how long do you need to stay closed? You really should stay closed for an incubation period of whatever illness you're talking about. I meant to delete that. I put together a better graph here for you. This is a little bit busy, but I put here a table of when different illnesses are most common in the population. Things are different from time to time, like we had RSV hit pretty hard and heavy earlier this year than typical. But just to give you an idea, you usually don't know what it is because they don't usually test for things like para-influenza or rhinovirus. But just based on the time of the year and the symptoms, you may have a general idea of what it is. So if you have a ton of kids that have runny noses, fevers, scratchy throats, they're not too sick, but they're just out of school, you might say, okay, it's probably rhinovirus, we'll stay closed for, one school week. So again, this just might give you some ideas. For most of these, I put a link to the CDC where it does give some good information on their symptoms, and it has a lot of just layman's information. So if you need to provide information to your families, you can. So again, knowing that there's a lot of stuff going around, not just COVID, I wanted to give you some resources here. Reviewing the outbreak definition for COVID, because it did get updated a few months ago. This goes through and explains what a school-associated case is, but basically anyone who's been in your school within the 14 days prior to testing positive or within 10 days after being ill or positive. So basically someone that could have exposed anybody else within your school. And then it defines what school transmission is. So basically anyone else that could have gotten sick from most likely being exposed at school. A school cluster is either 10% of your students and staff or at least 3 cases that have become infected, whether it's confirmed or probable, and there's no other likely cause for their illness. And then an outbreak is just where it gets more specific, where we're really honing down on it more. They're not in the same household, and they're actually linked somehow to the school setting. So they're in the same activity, they're in the same classroom, whereas a cluster is more just they're in the same school. So just a reminder on that, and the link to the official documents here. And again, just because you have 3 or more cases, it doesn't necessarily mean you have to close that whole classroom. Sometimes we have those other 2 cases pop up in kids that are home in quarantine, and they became contagious really while they were at home. So you've effectively prevented further spread. It technically then would be an outbreak because they're school-associated cases really, but you don't necessarily have to close down that classroom because they develop their illness at home, they've not exposed anyone else. So just another plug for masking. We have been hearing more about infections in staff and more breakthrough cases. And I did discuss that last week, just that the viral load with the Delta variant is so high. It is just much more contagious, which is why we do have that masking recommendation for everyone, whether they're vaccinated or unvaccinated, in all public places, in the schools, but also in any public place where community transmission is substantial to high, which is everywhere in Michigan right now, just because the Delta variant does have that increased potential to break through vaccination and cause illness. So we know it's challenging right now to really force masking with your general population, but at least with your staff members, as much as you can encourage them or incentivize them to wear a mask at school, but also in the community. This is obviously where most people are getting infected. It's not so much in the schools, it's in the community, and then they bring it into the schools. So you know much more than I do what the motivators might be for them, but things I can think of is that, if you have to close school for 10 to 14 days, you're going to have to go longer into the summer. If they get sick, they'll have to use up their sick time or personal time. And I'm just assuming this is the case. But again, you want to try and keep your schools going and keep your staff healthy. And again, we're seeing just so much happening in the community. So as much as you can encourage people to wear masks in the community, I would implore you to do that. And again, I just make another case for continuing to recommend masking for all your students in the community, rather than saying they're optional or saying they're not required. Continuing to just say they're recommended. You don't have to say they're required, just to encourage them. For students at school functions, especially, crowded indoor sporting events, making sure there's masks available at entrances and classrooms, at ball games, things like that. So we're starting to see cases climb up again, and with the holidays coming, just trying to think of things we can do to try to keep that under control. So for vaccine availability, great places to go would be vaccines.gov, and people can search by their zip code for COVID vaccine and flu vaccine. People can also call 211 for assistance in finding vaccine. Also with our area health departments, I put the links and the phone numbers on here. I know it's a lot of information, but we will get these slides out to you and also post them on our website. For the locations in Central Michigan District Health Department, several of our counties have clinics scheduled for the 5 through 11 and the 12 plus age groups. So I would encourage you to check out those different county links based on where you're at, because again, we have many community-based and clinic-based clinics coming up for those age groups. And then District Health Department 10 also in their events, the DHD10.org/events, they also have many community events, and they also have testing events posted on that calendar. So again, I just encourage those two locations to look for things like that. But if you have questions, there's phone numbers there as well, and appointments are also available. This might be a little bit too sciencey, but this was just a new science brief or data review that the CDC put out just recently. And I just wanted to review it because we do get a lot of questions about this, kind of the science behind, what's better, immunity from infection or immunity from vaccines. And if I've been infected, do I really need to get vaccinated after that? So this is just a review. It's a really long review of data, and so you can certainly go and read it in its entirety on your own, but I tried to put just some of the highlights here. So one thing they mentioned is that the current available evidence shows that people that are fully vaccinated and those that have been infected previously seem to be at low risk for another infection for at least 6 months. Now, they do not mention in there if they plan to extend that period of time where people who have been infected are exempted from quarantine, because right now it's 3 months. My hope is that because they've made this statement now, that is in their plans. So if that does happen, I guarantee I will let you know, and we will let you know and make that change. But this is what they're saying now in this science review. There's still insufficient data to say what antibody titer level really indicates that somebody is protected. So basically, we can't use an antibody test to say someone is immune. Recent studies demonstrate that waning antibody titers and vaccine effectiveness against infection occurs over time, especially among older populations. And if you've heard, it looks pretty likely that Pfizer at least will get indications for boosters for all ages. So that may be coming very soon. Decreased effectiveness in vaccines may be due to dropping antibody titers, but also changing variants. Many studies have found that vaccine effectiveness against hospitalization and more severe disease continues to be high, however. Randomized controlled trials appear to show higher protection from mRNA vaccines, whereas observational studies, which we know, if you know studies, randomized controlled trials are better than observational studies, but observational studies seem to show that protection following infection may be better. So, so I know you may hear studies back and forth, but right now it appears, there's better science supporting the immunity after mRNA vaccines. More recent analysis of data from hospitals has found that there's 5.5 times higher odds of becoming reinfected after illness versus after vaccination. And a recent study from the United Kingdom found that vaccination was more protective than past infection against the kind of the natural or original variant, but it seemed to be pretty similar between the two, whether vaccine or infection, against the Delta variant, the current variant. So that was more recent information. Studies comparing risks of reinfection among previously infected individuals who were never vaccinated versus those who were vaccinated, most but not all do show a benefit of vaccination. So basically, if you get infected and you do get vaccinated, most studies show that those people have better protection than those who never do get vaccinated after illness. Just in this here. So one study looked at a large group of individuals who used healthcare services, and they really didn't find any illnesses in whether you were vaccinated after illness or not. So that study really didn't give us any input. Another study found that people that were infected but did not get vaccinated after that had a 2.3 times greater chance of getting reinfected than those who did get vaccinated after their illness. And then there's been an observational study in Israel and in India that suggested that prior infection gave greater protection than vaccine alone, but those who'd been infected and got vaccinated had better protection from illness. So I know that's a lot of confusing information, but I just wanted to present that because I know we do get questions. So I would refer you to the My Start Map info page, as usual, for your area data. I did try to present some of it here. I'll show you that here in a minute. So this is the school age kids for our 19 counties here. We may not be continuing to see the persistence of that drop off. I'll go through each county one by one here. And what I did is I took a snapshot. On the left is the case rates per million, the daily case rates per million for that county over the last 3 months, just to give you an idea of the total population versus the school age kids. The school age kids is the absolute number per week. So, I mean, not apples to apples, but gives you an idea. So this is Aranac, Claire. And of note, this orange line is last year at the same time, and this is about when we started to see that first surge, that wintertime surge. So you'll start to notice that orange line is starting to tick up in most counties. Gladwin, Isabella, Osceola, Roscommon, and then in mid-Michigan, Clinton County, Gratiot, Montcalm, District 10, Crawford, Lake, Kalkaska, Manistee, Mason, Mecosta, Misaki, Newaygo, Oceana, Wexford. Now reviewing the data and modeling information from the state report this week. All of Michigan stays in the high transmission. Our percent positivity has increased from last week, and the state on average is at 14%. Many of our counties are actually quite a bit higher than that. So continue to encourage testing for anyone who's been exposed or has symptoms, because those high percent positivities are often a sign we're not testing enough. Our case rate has started to go back up again. In the last week, the only other state that had more absolute number of cases from us was California. The case rates among pediatric population, or the number of cases in our pediatric population under 12 went up 30% since last week. Our inpatient bed occupied by COVID patients has been continuing to increase. Our death rate did decrease from last week. Still, though, we had 304 people die from COVID over the reporting week. So as you can see, we were having a decrease, but unfortunately we started to go up again in the state. Here are our overall numbers for all of the major criteria. This is that overlay from last year to this year, and we're kind of connecting with where we were at last year at this time. Hopefully we won't continue to follow that. So this is by age group. So our 10 to 19-year-olds are still the highest, and that's followed by the 30 to 39 and the 40 to 49-year-olds. So I kind of see that as the kids and their parents are kind of in the highest groups here. This is the breakdown a little more specifically. This has the school age kids, the 5 to 18-year-olds in the state, followed by 31 to 50-year-olds are collectively the next highest group. So again, I kind of see that as the kids and their parents. This is the data the state has been tracking. Counties with schools that have mask regulations versus no mask regulations or rules. So And then this breaks it out a little bit more in those counties where masks are required versus no mask requirements, comparing the 5 to 19-year-olds to all the other age groups, and just showing the comparison there. Also on the bottom here, just showing how it's related to the other age groups in the county. All right, so this has the emergency room visits for diagnosed COVID. So we are starting to see that going back up again. The hospitalizations have really taken a steep jump recently. This is some numbers that I pulled here. This shows in our regions that these counties I'm talking to today are in the number of adult hospital inpatient beds that are available to us, and then how many are occupied as of yesterday, and what percent that is. So, for example, in Region 1, which is further south, we only have 2 counties that are in that region, but 90% of our inpatient beds were occupied, and 91% of our ICU beds were occupied. This is really the biggest concern right now. I know in Region 6 and in the Munson healthcare in Region 7, a lot of them are needing to go to kind of the crisis standard of care, which means that they're not able to really take care of patients in the best way possible. They don't have the staff or the facilities to do that right now. So that's really right now one of the biggest concerns. This is the ICU census statewide and the pediatric hospitalization statewide. And these are our pediatric hospitalizations in our region. Still Region 6 is the largest. And, we have DeVos Pediatric Hospital in that region. So, I'm sure that's a contributor. I added this in just because I think it's some interesting information. When we talk about the vaccination, can you guys just make sure your phones and computers are muted? Thank you. We talk about vaccination for the 5 to 11-year-old group, and one comment we often get is, well, it doesn't kill kids that age, so why should we do that? COVID deaths have been within the top 10 causes of death. If you compare it to the number of deaths with our most recent mortality data, which is from 2019. But as many kids die from COVID as they did from suicide. So again, it's in the top 10. It doesn't seem like that many, but I mean, if your child was one of those 66 kiddos within that year, it means a lot to you. So whether that means anything to anybody, it might, but I just wanted to share that information. The estimated benefits for every 1 million doses of vaccine that we get out to the 5 to 11-year-old age group, with the recent surge that we've had with such a high level of kids being infected, 1 million doses would prevent almost 60,000 cases of COVID, almost 230 hospitalizations, 132 cases of the MIS-C, and 72 ICU admissions. If you averaged out the whole pandemic, the benefits aren't as great because previously our kiddos were not as affected as they have been recently, but still definitely a benefit to the kids. So again, just some more information on that. Fortunately, we've only seen a 4% increase in our K through 12 and child care outbreaks. So that's good. And I will just skip right ahead to the slide. So our weekly new outbreaks has been pretty stable kind of throughout the school year. Those ongoing outbreaks just kind of keep going up because they just kind of keep continuing. And then the number of cases associated, again, with the new outbreaks is pretty stable. That is all I have at this time. I will stop sharing. All right. So I will get to my questions. Anyone has any questions, make sure and put them in the chat, or we'll do questions on the phone afterwards. So are there any community clinics scheduled for the 5 to 11 age group? I've seen 1 or 2, but they have been during the school day. So again, there are some clinics in Isabella County coming up, because I know that's probably the closest for you. I do know that Mid-Michigan District Health Department is working on scheduling one on Saturday, and we'll make sure and get that information out to the schools. So I know that that is ongoing to get all that
Dr.
set
Morris.
up.
Hi, Dr. Morris, this is Liz. We'll get that information out by Monday for next Saturday's clinic in Clinton County.
Okay. The other thing too is there are several pharmacies that are vaccinating the 5 to 11 year age group. And, you know, most of them, like Myers, they vaccinate on Saturdays and Sundays. Now that kids can be vaccinated, can you clarify whether schools can check on MICR, students' vaccination status for quarantine purposes? If so, do we need parents' permission first? So the information that was sent to us from one of the schools was a memo that stated you could. That was not sent to us. That was a memo sent to the schools from MDHHS. So I would encourage you to follow up with MDHHS to clarify that. But that was in one of my, I can't even remember what talk that was, but it was in one of my prior talks where I shared that information. But we were lucky just to have one of the schools forward that to us. But we have always been told by our MICR reps that you can't, but again, the schools were sent a memo saying they could. So if there's been some more discussion on that I am not aware of, I would encourage you to follow up with MDHHS or the Department of Ed to see about that memo, because I don't want to tell you the wrong thing. So here's a link. I'm guessing this link in the chat is probably that memo that I'm talking about. Yep. Yes. So thank you for sharing that. If you don't have access to the chat, well, obviously you do since you typed into the chat. So Mary, if you want to look in the chat under Deborah's comment, there's a link to that memo that gives that information. It seems the health department is not giving guidance anymore. What are we supposed to do when we have a classroom outbreak? So one is, I have schools call me quite often for guidance, so I guess I'm not sure what it means by we're not giving guidance. And I hope that some of the guidance I gave today was helpful. But if you ever need guidance, you're welcome to call me, and my phone number is pretty readily accessible, and I share my phone number and email every week on this call. So all right, that was the last question. Any other questions?
Dr. Morris, this is Stacy Kreiner from Alma Schools. I have a question about the data. I think it was slide 6. You had information in regards to how the outbreaks and clusters are defined. I just wanted to briefly review that for a moment, because one of the challenges that I personally am facing, I'm uncertain if any other districts are, but I would assume so, is the reality that our data does not match that data. Because the health department has access to additional information far beyond the reach of a school, and yet because those are reported, linked and connected back to the school by those definitions that you shared on slide 6, it causes a lot of challenges for us with individuals who may be pushing back and saying that we are not reporting everything that we should be, when in actuality, there's just that connection of outside of our reach information attributed to those clusters and to those outbreaks. Is there any way that we might be able to bridge that and just make sure that that's clear to the communities and public?
Yeah, and I think the question was like secondary cases. So if it starts in the school and then there's cases in household members that are due to school outbreaks, then adding to that outbreak count.
Yes, that's correct. School, my own district, we've monitored very closely when we've had 3 connected school cases. We call it an outbreak. I've reached out to Lisa, our health department. We've mitigated, and it's those ones that are being reported as outbreaks that I'm unaware of. And yet then they get published in the newspapers as school districts with all of these outbreaks, but really we as schools had no chance to even address that with our community before it gets published, because we don't have access to all those other individuals that get attributed back to the school.
Let me discuss it with my team internally, because I have some thoughts on that I'd like to talk with them about first. Just some other ways that we do it in the other health departments. But I just want to talk with them before I vocalize it.
Absolutely. I appreciate you giving it some thought, and even if it's just clarification somehow that we can refer people to so they understand that discrepancy between our school reported data versus the health department data. And it's not that anyone's data is in error, it's just different requirements.
Well, and what you put on your website really only has to be cases that were contagious in your building. So if someone goes home on quarantine and becomes positive at day 5, you don't have to put that on your website technically, because they're not ever in school when they're contagious. So, things like that are really difficult to get across to the community, but it is just some strange semantics. But I will talk to my group about that, because again, with the 3 different health departments, they all do it a little differently, and I just want to make sure I know what I'm talking about before I say anything, and that we're all on the same page with that.
Great, thank you so much.
Yep, no problem. Let me get back to my physical schools are following. All right, any other questions that anyone has? All right, well, hearing none, we will get slides out and recording out. And again, check our website for information on clinics. And we will, I know Central has sent them out to the schools, what we have scheduled so far. The ones we are working on for Mid-Michigan District, we'll get that sent out to you as well. If you have any questions or concerns, just give us a holler. Have a great rest of your week.